Hi, welcome to Child at Hearts. I'm delighted to have you back on this channel. Thank you very much to all our returning subscribers. And if you're just seeing this video for the first time, this is Child at Hearts. Here you have content and everything you need to know about childcare, childhood education, consulting, everything that has to do with schooling, education within the four walls of a school, outside the four walls of a school, online learning, everything that has to do with childcare education from 0 to 18 years. You have that in this channel. You also have everything that has to do with taking care of children, caring for children in line with best practice, in line with global education. So I'd like you to click the subscribe button and the bell notification button so that you can see updates and videos when we drop any. For some of us that are not new in this channel, you already know that this month of January we dedicated it to special education needs and disabilities. Children that are living with one disability or one delay or the other that is impacting or affecting their learning. Now, we talked about ADHD, we talked about dyslexia, we talked about autism. Although we didn't talk about autism in details and ADHD in detail because these are broad topics. If you want to know more, you can send us a message or you can put it in the comment section. Then we'll have to do a special video on these topics. However, we cannot end this January without touching this particular topic we will be discussing today. So for some teachers or for some parents that have assessed their children, or you've looked at your children and you see this child is neither experiencing dyslexia, this child is neither autistic, this child is not suffering from any ADHD, but I see some mood swings, I see some sort of depression, I see some sort of highs and lows of mood swings. What exactly is going on with my child? Now, what if it's bipolar? Bipolar disorder is a disorder that is associated with different episodes of mood swings, ranging from depressive highs to manic lows. Another name for bipolar disorder is manic depression. It's a very extreme form of depression. However, the beautiful thing is that there is a solution to bipolar disorder. We will see that in the course of this video. Someone will ask, what are the causes or what could cause bipolar disorder or manic depression? Research has stated that bipolar disorder is frequently inherited, which means that if a parent or if a grandparent experience bipolar disorder, it's possible that the children will experience it. However, if the conditions or the factors that work together to cause this bipolar disorder are checked, the person might not experience it. Statistics have also stated that 51% of people living with bipolar disorder experience childhood trauma. That is why we are doing this video. That is why we are creating this awareness. So for parents and for teachers to understand that the conditions with which a child is groomed, the factors, the place, the environment, the people that form the childhood of a person matters a lot. That is where manic depression starts from. However, there is no particular cause of bipolar disorder. It is stated that different factors work together to cause bipolar disorder. Factors such as environmental factors, physical factors, social factors, example, hardship, poverty, abuse, molestation, related stress issues. These factors work together to make the genetics and the chemistry of the brain to develop bipolar disorder. What are the signs and symptoms of bipolar disorder? Before we go into the signs and symptoms of bipolar disorder, please note that Bipolar disorder starts manifesting or starts showing its full signs from the time the child becomes a teenager. From 13 years, from 14 years, from 15 years, from 16 years, from 18 years and above. Why? Because when the child is still a child, these factors, these experiences are forming together to make the child to become, so the child does not show the signs. It's when the child becomes a teenager that you see the full-blown manifestations and signs of bipolar disorder, which affects the child's academics, affects the way the child relates with other people, affects the way the child manages themselves, their self and their behavior. You see the person is in a high spirit today. In splits of seconds, the person is in a very low mood. They have suicidal thoughts. They are not able to control or manage their emotions. The beautiful thing about this is that there is a solution. Now we're going to look at the solution. But before we look at the solutions, let's talk about the signs and symptoms of bipolar disorder or manic depression. There are so many signs and symptoms of bipolar disorder. I'll mention but a few. 1. Loss of sleep. The person loses interest in sleep. The person is not able to bring themselves to sleep. They are not able to have rest as at when due. The second one is loss of touch with reality. They are not realistic. They live in the world of their own. Once they get into that mood swing, they live in a world of their own. They hallucinate. The third one is depressive moods. Everything that has to do with depression at its extreme level. Mood swings, highs and lows without any form of control, loss of interest in daily activities. They are always pessimistic about life. They lose interest in everything that life has to offer. They are not self-motivated. These are a few among many signs and symptoms that bipolar people or persons living with bipolar disorder experience. Now let's talk about how can we help bipolar patients or people living with bipolar disorder. Medical practitioners have a better way of helping people living with bipolar. But the first step is for you to identify that, yes, I'm experiencing bipolar disorder, or yes, I'm seeing signs of bipolar disorder and I need help, or this person needs help. What can I do? The first thing is for the person to be aware of it. The second is to be willing to be open about whatever it is you feel that triggers such thoughts, suicidal thoughts, such thoughts of depression, such mood swings. What is it that you feel or you remember and it triggers it? A lot has to do with childhood trauma, like I said earlier. You give the person time, give the person a conducive atmosphere to talk about it. You don't judge them, you don't accuse them, you listen to them, you're empathetic with them. Most times we use the help of professionals to work with people with bipolar disorder. They are better people to handle such cases. I'd also say that it's best as a parent, if you see such signs in your children and it's affecting their academics, it's time for you to slow down in your criticisms. It's time for you to slow down in your comparisons. It's time for you to slow down with the pressure you're mounting on them, because what might be going on with them, you might not be able to understand it, but then give them the space, give them the opportunity to express themselves and find a way to relate with whatever it is they say is triggering such behavior. Sometimes it might not make sense. However, that is the only way you can connect with them. And once you connect with them, that is the first step to getting them out of such disorder. There are also methods that different health practitioners use to help, or social workers use to help people experiencing bipolar disorder. Another step is therapy and counseling. You get the help of a professional guidance and counseling unit, or the help of a professional guidance and counselor, or the help of a professional therapist to give them room to get into their world. You get into their world with them and bring them out of that place of depression. It's not something that happens spontaneously. It's going to be one step at a time. Days might pass, weeks might pass, but then as they are opening up, as this healing is taking place, they're talking about it, it's also finding a way to bring healing to their emotions, to that psychological part of their brain, to their senses, to their body. Now they know that they can feel the environment around them. Someone understands them. By the side, medical practitioners also have some medications they administer while this therapy, while this counseling is going on. Most of these medications will help them sleep, help them calm down, help them relate well with people, help them control their thoughts and their speech. I don't know how helpful this video has been to you, but what I would advise that you do as a parent, as a teacher, is to be very observant, because children learn by observation. So as teachers, we teach most times by observation. So when you've observed that the child you're working with is withdrawn, the child you're working with is not following, is not connecting, and you know this child is not experiencing autism, this child is not an ADHD child, this child is not dyslexic, what if it's bipolar? Check the signs and symptoms that are showing and then call the attention of your supervisor as a teacher. As a parent, call the help of a therapist, the help of a counselor to interview this child, to find out what is going on with them. It could be different factors. It could be something they saw on telly, it could be a conversation, it could be something that is going on with them that they don't even understand. It could be a conversation that they lost and they feel rejected, and it begins to form from there. Remember, there is no one particular reason or one particular cause of bipolar disorder, but there are different factors that work together to cause this genetic and chemistry change in the brain. So as a parent, watch the people that take care of your children, the kind of words they use, the way they handle them. Watch the surroundings, the stress level you expose your children to. Is this something they can take? Is this something that would affect them later on in life? Most times we feel that these things we expose the children, these factors do not affect them. But then later on in life, these are things that have come together to form this brain disorder. I believe that you're going to do what is needed for that child in your care, understand them, know what is going on with them, and get professional help. Why? Because we are raising holistic children. There will be people that will experience healthy relationships, people that will also transfer these healthy relationships, healthy personality to their children in future. Thank you very much for sticking with us. Please click the bell notification button and subscribe to this channel, and have a wonderful one.